Welcome to the Read, Talk, Grow podcast, where we explore health topics through books. Our topic is diabetes mellitus type 1, and our book is Salty, Spiced, and a Little Bit Nice by Cynthia Timoti. I'm your host, Dr. Denise Millstine. I'm an assistant professor of medicine at Mayo Clinic, where I practice women's health, internal medicine, and integrative medicine. I'm so excited about my guest today. Cynthia Timoti is an Australian author of multicultural romantic comedies known for their heart, humor, and sharp cultural insight. Her debut novel is Salty, Spiced, and a Little Bit Nice, and it blends romance with themes of family expectations, chronic illness, and identity, and has been praised for its warmth and authenticity. Born in Jakarta and now based in Melbourne, Cynthia writes stories where happily ever afters are always guaranteed. Cynthia, welcome to the show.
Thank you. Thanks for having me. I'm very excited.
Mary Elizabeth Boyle is a nurse practitioner at Mayo Clinic in Arizona, specializing in endocrinology with a focus on diabetes and metabolism. She provides comprehensive care for patients with type 1 and type 2 diabetes, including advanced diabetes management and continuous glucose monitoring. She's been an integral member of the Mayo Clinic diabetes care team in Scottsdale for years. Mary, welcome to the show.
Thank you for having me.
Mary and I know each other. I have her phone number on speed dial for my patients with extraordinarily high blood sugars. So it's fun to work with her on this project. Salty, Spiced, and a Little Bit Nice is a modern romance novel featuring financial expert turned healthy baker, Ellie Pang, whose diagnosis of diabetes type 1 in childhood led her to learning about making delicious, low-sugar desserts, all while maneuvering under the thumb of her meddling mother, who does not always have her best interest at heart. Ellie was heartbroken by her brother's best friend, Alec, as a teenager who, of course, this being a romance, surfaces while Ellie is trying to find her feet and independently start a new life. Okay, you both know how Read, Talk, Grow works. We discuss books that portray health topics in an effort to better understand health experiences through story. In this case, we're talking about type 1 diabetes. Cynthia, tell us your inspiration for the book.
This goes back 6 years ago now during COVID. So during the pandemic, we in Melbourne, we had a lot of lockdowns. And during one of those lockdowns, we noticed that my son, my youngest son, who was almost 7 at the time, he began to be very thirsty a lot of the times, and then he went to the toilet very often. He would go at night, he would wet the bed, and then we were wondering what is wrong because he's almost 7, he doesn't wet the bed anymore. So we took him to the GP, to our doctor, to have him checked, to have a blood test. And when the results came back, we were told that he had type 1 diabetes, which was very shocking because we didn't have a history of type 1 diabetes in the family. And then, we started to go through all the tests, all the hospital visits and all that. And a lot of people, when we shared the story of him having type 1 diabetes, they were wondering what it is. So they were asking questions like, is that because he's had a lot of sugar? Is that because he's not eating healthy? So there were a lot of questions and people who are not sure what's the difference between type 1 and type 2 diabetes. I was actually trying to get my novel finished at the time, and then it was a completely different story at the time. And then I thought maybe if I gave my character the same condition that my son has, and then it would probably help in a way, to not educate people because I'm not a doctor, but just to raise a bit of an awareness of what it is and then how it's different from type 2 diabetes. And my family actually had a history of type 2 diabetes because my mom had one. So I just wanted to share with some readers how it's different, what it is, and what caused it. And yeah, so that's what inspired it.
This makes a lot of sense when we see some of the scenes in the book. So I'm pretty excited to dive into them as we talk more. But first, Mary, tell us your reaction to the book and also what it's like to work in diabetes.
Well, Cynthia, I have to tell you, this was a very authentic book. The writing was lovely. I enjoyed how you intertwined the diagnosis of your son and the diagnosis of diabetes, not particularly his story. And I didn't know until I read the end what your inspiration was. but it brought in so many themes, that of the family, their thoughts, their worries. How do we keep this young person safe? And then, of course, when the young woman says, "I've had enough of my family, it's time for me to spread my wings," and off she goes, there was concern that she may be at risk for not being able to take care of her diabetes. But it was clear to me by how you wrote that she understood diet, exercise, the importance of staying connected with people. And finally, I just loved how the love story was intertwined with the story. The diabetes wasn't the whole story. It was like you made Ellie the central part of the picture. And oh, by the way, she has this disease called type 1 diabetes.
Thank you. That's really nice to hear.
Big distinction. What's your day like, Mary, working with people who have diabetes? What does that look like?
Well, when I was working full time, I had a mixture of patients with type 1 and type 2 diabetes. And we know that the population data shows that 10% of the patients have type 1 diabetes. And as it turns out, type 1 is my favorite disease to manage because it is not more difficult than type 2, but the patients don't really or can't take a break from managing their diabetes. It's with them day in and day out. I remember reading a statistic years ago that said the patients who are most successful managing their diabetes spend 3 hours a day or more. And when you think of the young child that you have now growing, 3 hours of his day is a lot because he's more interested in going to school and playing and eating snacks and just being part of a family. And then when you segue to this young woman in the story, she had mastered how to manage her diabetes to the point of all the cool snacks and treats she was making. That resonated with me because it's the biggest piece of the puzzle that I know patients struggle with. What do I eat? This is too much work. I want this, and it's too many carbs. And she found a way to work it into the meal plan, which, if I had to ask you, is that what you did for your son with the special recipes and desserts?
Not as much as I did in the story because we also thought that we wanted to try to normalize eating as much as possible. So we always tell him that you can have anything you want as long as you make sure that you do the right counting for your carbohydrates and then you put in the right amount of insulin. It doesn't limit you what you can have. So we do try to incorporate as much as normal eating as possible. But yeah, every now and then sugar free, he would enjoy. He would love it if there's anything sugar free that he can have without worrying about the carb and the insulin and all that.
I also wanted to congratulate you on the team of experts that educated you, your family, and your son because it was COVID and only the first responders were allowed to come to the office. And I remember meeting people at the local coffee shop where there was internet to help them get their continuous monitoring of the glucose set up or some other issues. Can you share with us anything in your experience about how your educational experience was with your son?
Yeah, we're quite lucky in our state in Victoria. We've got a children's hospital called the Royal Children's Hospital in Melbourne. And when we were diagnosed, we were told to immediately come to the hospital. And we spent, I want to say, probably 3, 4 days at the hospital just for him to get familiar with. We were doing injections at the time. We were doing MDI, so for him just to learn what the disease is and for us just to get familiar with all the injections, all the terms, all the whatever we have to do to get by. Yeah, so it was quite tough because we, like you said, it was only the first responders that were allowed out. So we were quite lucky that we had access to the educational team that were helping us understand what the disease was about at the time.
It truly is a whole new language, a whole new way of thinking and way of living. Let's dive into the experience of Ellie, who's the main character of the book. Cynthia, we meet her when she's an adult. She has a pretty disastrous public event that goes viral on social media. And this leads her to examine the influence her parents are having on her life and really the control that they're exerting on her life. So in the second chapter, she's going to confront her mother about this controlling nature. And she's thinking back to her diagnosis of diabetes. And she says, my unexpected type 1 diabetes diagnosis completely redefined my life. Will you just talk about the time of her diagnosis, how that happened, and how that was kind of a before and after moment for Ellie?
Yeah, sure. I guess in a way that was also a reflection on my son because before the diagnosis, he was quite, I wouldn't say careless, but he would have whatever he want with in terms of eating and then in terms of playing, exercising. And then after the diagnosis, we learned that he had to be a bit more careful. Like we had to watch what he was eating. Not that we're limiting anything, but we have to make sure that we know how much insulin to give him. So I thought that would be a good thing to put in for the character because for us at least it does represent a before and an after. Yeah, so after it was like a lot more limitations, I guess, but also being a bit more careful with what he's doing, what he's eating. So yeah, so I guess that's what I'm trying to portray in the scene with the character, a bit of a reflection of what actually did happen to us.
It's so interesting to me that Ellie was not doing well. I mean, she was having the symptoms that you had described. She's drinking a lot of water, having to go to the bathroom all the time, eating a lot of food. And it actually wasn't her parents, it was her friend's parent who was caring for her and was like, something is kind of disastrously wrong here, and brought her in to get care. Mary, will you just reflect on the diagnosis of type 1 diabetes, particularly when it happens in childhood? Is it a pretty common story where the symptoms are kind of explained away initially and not recognized? Or what's been your experience with that?
Well, in children, yes, I think a lot of times, especially if it's happening in the summer or the early spring, most people say, well, it is hot outside. And, I can understand why they're drinking more and they may have had an accident in the bed. However, if it's happening in the time of year when you wouldn't expect that, some of the families may be more concerned. In the early age groups, I think it might be picked up sooner than it might be in the teenage and the older adult groups, just because you kind of poo-poo these symptoms. So I like to think about the part that in Cynthia's case, getting her child to the doctor because she noticed those symptoms. The child is in the home, she noticed, and they knew what was normal behavior. When you're diagnosed at a later age, you may not pay as close attention.
We were also quite lucky because our doctor at the time who we went to see, his son has type 1 diabetes. So he was very quickly saying to us, okay, you need to get a blood test because this is not normal. And I've heard stories where some doctors, like you said, Mary, would probably say it's okay, it's normal during the summer months or whatever. So we were actually also quite lucky to have a doctor who had an instinct of what might be going on.
Yeah, but it takes that awareness and that sensitivity to kind of hear, oh, maybe this isn't just a hot summer month with the person who's playing outside or sweating outside and is needing to drink more fluids. Mary, Ellie's parents blame the food she's been eating right after her diagnosis, saying it's, that she's been eating this junk food. Did that have anything to do with her developing diabetes?
No, it did not. As most of us know, that the type 1 diabetes is an autoimmune process where the body kind of destroys the cells of the pancreas. And there is usually not a family history. And it is frustrating to people because you always want to find a reason, why did this happen? So I like what Cynthia said, saying to her child, listen, you can eat what you want, you just have to account for it. But I also did want to say I have compassion for Ellie's parents because I wonder what education they had when Ellie was diagnosed, because so much of the dietary part is still misunderstood. And when I take care of type 1s that maybe have had it 30, 40, 50 years, the first thing I inquire about is their diet. And sometimes they're like, listen, I've seen enough of those plastic models. I don't want to see plastic grapes or how much meat I'm supposed to eat. I want to eat this. So I make sure everybody sees a dietitian so I know how many carbs they're supposed to eat. And then I'll swivel the picture into the point of, can you tell me what you like to eat? And let's fit this into your lifestyle. Dealing with adults, it's kind of challenging because by the time you're a certain age, you don't want to make any changes.
Or it's harder, or culturally it's more of a reversal of what you've become accustomed to. Absolutely. Cynthia, let's talk about Ellie's love interest. That's Alec. So from the time she's a very young girl, she pines over Alec and has a quite a disastrous end to that interaction. But then, this being a romance novel, he re-enters her life when she's just overcome with stress from finding the storefront she's rented for her new bakery in a complete state of disarray. She trips over this collection of dog leashes. She lands on the ground. He comes upon her, and his first thought is that he's worried she might be having an episode of hypoglycemia. What is that?
A hypo is when the person's blood sugar drops below a level that is acceptable and that is normal, like for a person. In Australia, we say it's below 3.9, but I think in America you use below 70, Mary. Am I right in saying that?
Yes, yes,
Yeah.
you are correct,
Yep.
Cynthia.
Yep. So when somebody is having a hypo, like in the case of my son, he would tell me that he would feel very like disoriented, and then he would feel very weak, and then he normally can't think straight, can be a bit cranky sometimes. So it can be dangerous because when somebody's blood sugar drops very low to the point of below 2.2, I'm not sure what that is, Mary, but somebody can be unconscious, and then I've heard in severe cases they can actually die. So it is very dangerous. And with the case of my son, and then everybody else who has type 1, I'm sure that when he drops below that certain level, we have to give him a lot of some sugar to make sure that it goes back up.
Mary, why is there this difference in the levels that Cynthia is experiencing in Australia compared to what the numbers would be in the States? Is it a matter of the units that the blood sugar is measured in? And can you just give us a range of what an American listener might be looking for these hypoglycemic episodes?
Sure. So it's a matter of the metric system that I believe that Cynthia is using, and then the Americans never really adapted that in other parts of the world as well. So in the US, it's typically a low sugar is depicted as anything under 70, and most of the continuous glucose monitors have a reading of 55 where it cannot be turned off. But what Cynthia was also referring to is when your sugar is in the 40s, you could have some neurological symptoms where you may not be able to speak, or you may feel numbness around your lips or your tongue. And there's always this term I used to hear, the lights are on, like the person's eyes are open, but they're just not there. And so having that quick acting glucose is really important. And one thing I wanted to say, Cynthia, was what I like so much about how the management of the hypoglycemia was in the book. It was that it was positive from the standpoint that she knew what she had to do, but she got into a situation, I think, where alcohol could have been involved, and it kind of blurs the sensorium a little bit, which would not be for your son at this point. The other thing, too, is sometimes people who don't understand that hypoglycemia can occur even when a person is doing their level best to take care of themselves. It can be kind of like a stigma. And I never got that from this experience. And I was reading the book thinking, oh, please, I hope hypoglycemia isn't going to be portrayed as a negative thing. And then segueing to the soon to be boyfriend's experience, how supportive he was. And when you have a person with diabetes, the next best thing to a supportive family is a supported significant other. And it just so happened that it worked out for her. I shouldn't say too many things about the story, so I don't spoil it for people that'll read it, but it was truly just a very inspirational part of the book that I really enjoyed.
Oh, thank you. It's really nice to hear that from an expert. But also, we were told when in the first week that we were diagnosed, we were told that if you manage your diabetes well, there will always be a hypo in your life. It's a normal part of having like a good management of type 1 diabetes. I think that's what I was told, that you can have hypos. It's a normal part. So we don't see it as something negative in our family. So I'm glad you said that, Mary. That was really nice to hear.
Hey, listeners, we hope you're enjoying this episode of Read, Talk, Grow. If you find our discussions helpful and insightful, please take a moment to subscribe to and rate Read, Talk, Grow on your preferred podcast platform. And don't forget to tell your friends to listen. Your support will help us reach more readers and those eager to learn about health through books. As always, feel free to drop us a line at readtalkgrow@mayo.edu with suggestions for books, topics, or any comments. Thanks for listening.
Well, and of course, the blood sugar is fluctuating. And so I think another way to say what you've just said is that if you're aiming for tight control, for excellent control, then you are at times walking this fine line, which means you might cross over that line a bit into the low blood sugar. And sometimes you cross that line into a high blood sugar as well. And the idea is to sort of figure out how to regulate that to the best of your ability, but it's not possible to always have the same blood sugar 24 hours a day because you eat, you have hormonal shifts, all these things are happening. Mary, I wonder if you'll comment about the importance of exercise. What we see with Ellie is that she's learned this process of normalizing her exercise in the morning with a morning run that seems to help her. But then we see her later when she's unexpectedly having to walk in the hot sun, and actually that extra amount of exercise, particularly paired to a little less access or a lot less access to food and water, now wreaks havoc on her blood sugar. Will you talk about the role of exercise and how that interacts with blood sugar levels?
Yes, so we all understand how important exercise is, but it's challenging for the person with type 1 diabetes, mainly because sometimes they'll try to let their numbers run a little higher so they can bring it down more gentle with that. Sometimes, if your sugar is above a certain point, your providers don't want you to be exercising. But each person has to figure out when is their time that they want to exercise, whether it's early morning, late afternoon, and also keeping in mind that sometimes it's a good idea to start with a little bit of carbohydrates in the system. Some patients are on insulin pumps and things of that nature, so they have to be aware that there are many things that they have to consider. And in all the meetings I've gone to, it's the big question mark that I hear from experts around the world. Managing your diabetes and figuring out the right kind of exercise for our type 1s is difficult, but I keep attending different meetings just to get a different thought. And some proponents say, yes, do this. Others say, no, don't do this. And I'd be curious from Cynthia's standpoint, how did you get the exercise for your son in terms of, I know they have it at recesses and things of that nature. Does he like doing it during the day? Does he like doing it before school, late in the evening?
He normally does it during the day, mostly during school, I guess. Like you said, it's different for everyone, I guess, and it's also different depending on what sort of exercise he's doing. So some days when because he does a lot of running, he's into athletics and he's into swimming as well. So there are days when he does his athletics and then we'll find he will crash at night after a long day, after a day full of activity. But also sometimes he might run a bit high. So it sort of varies and it depends day to day and also depending on what sort of exercise he's doing. But yeah, we do encourage him to do a lot of exercise as much, not a lot, but as he's a very active kid as well, so exercise is always good for everyone, but we do encourage him to be quite active instead of, because he's into gaming as well, so instead of just sitting around at home, staring at the screen.
Oh my goodness. Yes. Yeah, that's excellent. Staying busy. And with using the continuous glucose monitoring, you have an idea where his glucose is when he starts the exercise, and then every 30 minutes he keeps an eye on it. Sometimes with my older patients, they would tell me that when they weight lift, their blood sugar would go up a little bit, and when they ran, their sugar would drop. So they'd start their day out with a little bit of weightlifting, so they would have a little bit more of the higher sugar, and then they'd start their exercise. But always having that extra glucose on board, whether it be in the form of juice or Skittles or some sort of candy. The nice thing about the continuous glucose monitoring as well is that your son can connect with you and your husband, family members, and also with the provider so that other folks can watch what's going on if they notice. In the terms of the family member, that's a commitment that you make. Is that something that you do to watch his glucose control?
Yeah, absolutely. We are with the CGM that we're using. I'm able to follow him on my phone, and so does my husband. And it's whenever he's away or he's at school, we're able to see what his numbers are. And it also gives us a peace of mind knowing that he's okay. And whenever because he's been to sleepovers and all that, so it's also good to know that he's been to school camps where he's crashed at 2 at night because he's had a very active day. And we've had school nurses calling us saying, this is what's going on. What do we do? It's a lot of peace of mind for us knowing that, he's okay. Somebody's looking after him. So yeah.
Mary, your career, you're in the later part of your career. And so you have seen these CGM technology just come to even exist. I mean, when you started, people were checking their blood sugar really only by the old school. You prick your finger, you put it on some sort of testing strip, you plug it into a machine, and that gives you a single point in time. But you have to actually take an action to learn what your blood sugar is at a given time. And I wonder if you'll tell our listeners in a little bit more detail, what is this CGM? What does it look like? And, how is it working such that you're able to see, or your parent or loved one is able to see what your blood sugar is literally moment to moment?
Yes, and I can still recall in the middle of the 1980s when we did have the blocks, it looked like literally a brick. The first glucose monitor that came out, and then the strips. And if you sprayed it hard enough with water, everybody's sugar was 80 to 120. And we thought this is magical, only to figure out that that was not going to work. So fast forward, the sensors have gotten better. There is one that is the size of a nickel, one that's a little closer to the size of a quarter. Almost anybody who is interested in their glucose control, whether you're a person with pre-diabetes, type 1 or type 2 diabetes, can get a sensor if you're interested. They are very easy to put on. You connect either to your Apple phone or your Android phone. And one of the most wonderful things that's coming out since we are talking about type 1 diabetes is there is now a drug that can be used to stall a person from going from stage 2 type 1 diabetes to full-blown diabetes called teplizumab or Tzield. And we've never had anything like that in our history. And so when you have a person with type 1 in the family, whether that be the mother, the father, or one of the children, maybe an aunt, uncle, even a grandparent, I ask people to get their antibodies checked. These are the autoimmune antibodies that can tell you if you might be a person that will go on to develop type 1 diabetes. So part of the interest in type 1 for me is once a child is diagnosed, and I think Cynthia, in your son's case, he did not end up getting the ketoacidosis that develops when his sugar was really high for a period of time. But other children and some adults are not as fortunate. So if you know, let's say if there's type 2 or a family member with type 1, and that you've been told that you have one or two of the autoantibodies, having this person check their glucoses even on a quarterly basis, the family and the providers are going to know so that we can prevent this child from suffering, as well as the family, because it is a family problem, and culturally, families stick together to try to help each other cope. So I'm a big proponent of the continuous glucose monitoring. Cost is not an issue like it was so many times before. And if you connect with in this case, your provider, if it's someone that is very familiar with diabetes, they can help you, or certainly through the American Diabetes Association. Oh, and Cynthia, will you help me with the name of what we call the Juvenile Diabetes Foundation for Type 1?
Yes, so it's now called Breakthrough Type 1D.
Yes, Breakthrough Type 1D. And I wanted to emphasize that people with Type 1 can be infants all the way up to 80 plus years of life. We used to think it was people under the age of 20, type 1, and anybody older was a type 2, but we now know that that isn't always the case. And I have uncovered patients that were told they were type 2. And then when I do a little family history, I realize that their grandpa may have been a type 1, and then they have the antibodies. It's not always a difficult thing to talk about, but it can help the person know that if we do some preemptory education, maybe we can keep them out of the hospital, out of the emergency department, and home where they are comfortable and safe with their family.
We no longer always have to wait for these extreme symptoms and even cases of the high blood sugar. Cynthia, you made a reference to counting carbohydrates for treatment. And there's a scene in the book where, Ellie and Alec are really in tension. I mean, this is romance. There's going to be conflict. They're in tension the whole time. I mean, we knew that there was going to be a happily ever after, Mary. So I don't think you spoiled it for anybody. But in the tension, they're constantly trying to jab at each other and then do something nice for each other. And so one morning, Ellie comes down. She's staying with Alec because she's new to the area. She comes down and he's made her these whole grain pancakes. And so in the book, she says she's doing some mental calculation about the carbohydrate content of the meal to adjust her insulin pump. Cynthia, what does all that mean? What is she doing in that scene?
So this is what we do in our family, and maybe Mary, later you can tell us if it's right or not, if it's the correct way of doing it or not. So usually in meals where because with if you got and then it's packaged foods that you're eating, there's usually like a nutrition information on it, and then you can see how much is the cup, how much you have to put in based on what you're eating. But at home, when we're cooking something that doesn't have a set amount of carbohydrate in it, we often have to sort of estimate what sort of carbohydrate amount that he's having and then how much insulin we're giving based on that. So that's what I was trying to convey in the scene, just trying to estimate how much she should be giving herself in terms of insulin. But yeah, Mary, I don't know if that's the correct way of doing things.
It is so correct, Cynthia. There's no wrong way to manage a person's diabetes, but I will tell you that it is difficult. And back in the day, we used to pray for, is there just a magical picture that we could just take a picture of what the food looks like and tell us approximately how many carbs? And as it turns out, some of the continuous glucose monitors will now be able to, you take a picture before you eat, and then you can look at your 2-hour post-meal blood sugar and say, I guessed correctly. I was talking to a dietitian yesterday and she said it really works well if you have the grapes here in one area and then you have your cheese sandwich here and maybe something else that's easy like a glass of milk. But when you have like lasagna or a bowl of pasta, it's hard to estimate. So I always say to people, it's important if somebody really loves pasta that you never take that away. If they really love rice, that you never take it away, but you say, how much are you eating? Can we measure it? And how much rice is the amount for one serving of carb? And then you modify it. And the cool thing about working with your young son who's growing is as he grows, he's going to be able to eat more. And the more active he is, he can eat more than he could if he wasn't as active. And then you segue to a person with type 2 diabetes, and our eyes are always bigger than what they should be in terms of what we're eating. We sometimes have to say, now you're eating that full cup of pasta, but the activity in your life isn't measuring up as much. Can we either do more activity or cut back a little here? And through the glucose sensor, then I'll say, now do an experiment of eating 1 cup of pasta and then maybe do 2/3 of a cup at the next time. And then they'll say to me, well, I didn't really like to do that. So I made this adjustment and this works better for me. And I'm like, perfect. I don't have the answers either. but it's trial and error. And a lot of the our artificial intelligent apps that are coming out are really going to be helpful in terms of you roll up to a grocery store and you say, "This is what we want tonight," pulls up all the ingredients and you can see how many carbs. Or if you're going to a new restaurant and you're like, "Is there anything there I can eat?" If you're a vegetarian or a flexitarian or a pescatarian, you always want to know what's available.
It's so great because I think in the past there was this tendency to eat some packaged foods because the nutrient label is on that. And now we have technology to help people eat healthier foods, home prepared foods, but also still be able to count these carbohydrates. This is probably a good point to talk about glycemic index. Cynthia, what is that? I think Alec looks up some low glycemic index recipes for Ellie.
Yes, so low glycemic index food or low GI foods are food that will not spike up your blood sugar as fast. So things that are not low GI, like Skittles or your ordinary candy, it will spike up your blood sugar like really fast and then you will crash really fast as well. Whereas with low GI, it will bring your sugar level up in a steady way. And that's better for people with type 1 diabetes because you don't get that hyperglycemia and then you don't get the hypo after. So it's always preferred, I guess. Mary, would that be your experience?
Yes, yes, it definitely is, Cynthia. And sometimes people don't always understand that when they're telling me stuff. And so let's say, I know I'm supposed to eat brown rice, but I don't like the taste as much as I like white rice. And I'll say, well, what does your sugar look like when you eat white rice compared to brown rice or pizza or different types of foods? And while I may not always use the words the glycemic index, I'll pretty much say, what is it that you want to eat? And what have you noticed that keeps your blood sugar nice and steady? The other thing that helps too is matching protein with your carbohydrates instead of just eating a whole carbohydrate laden meal. And that's really, really helpful if you had the time to do meal prep. And so many people do that on Sundays for the whole week. And some like go to the cafeteria and try to figure it out on the fly. And it's difficult.
And what's the insulin pump that she's using, Mary? So Ellie is dialing into her insulin pump. There's a scene where the reservoir on her pump is running low. There's also a scene where she and Alec change the insertion of her pump. Can you talk about some of those details of the insulin pump in terms of what it is, how it's used, and what people need to manage when they have a pump?
Yes, so an insulin pump is a device that delivers a small amount of insulin in the background, which we refer to as the basal. And it's typically the rapid acting insulin. And then we figure out how much bolus that they need to cover the food that they're eating based on an insulin to carb ratio. So we fine tune these insulin to carb ratios. Maybe we start out with 1 unit of fast acting insulin, which would be something like Novolog or Humalog, to 15 grams of carbs. But over time, with these fantastic insulin pumps, we've noticed that the insulin to carb ratio comes down nicely because these pumps have gotten better. And we can estimate the basal needs of somebody, meaning how much insulin do you need in the body to keep a person alive? But what we have to figure out is how much insulin to cover the food. And so there are so many cool algorithms that you can work with, and it's an amazing tool. But the family needs to be well educated, the person needs to be well educated, and with the infusion sites, there can always be issues and problems. So keeping a close eye on that.
And it's literally, I think of it as looking like a pager. Maybe that's an old school pump, but it looks like an old pager from the 1990s. And it has a cassette of insulin liquid in it. Is that right?
Yes, it does. And some of the pumps are thinner than that now, and some are actually pods. There's one is it sounds like that may be what your son is using, the Omnipod then.
No, we're on tandem T-Slim, which is the one, it's still connected to his body with like a plastic tubing. But yeah, we've been looking at the pods, so maybe one day.
And the cool thing, as you know, Cynthia, is he has this tool now that can help him replace the insulin that he doesn't make. But it's truly amazing, especially if he's swimming, if he's doing all his different sports, how he manages that. It connects also to the continuous glucose monitor, and it delivers insulin precisely at these tiny, tiny doses. And what I like too that is so cool about the companies, you can switch pumps around as he gets older, as maybe sometimes I would see people use the Omnipod when it's time to go to the beach, because then they didn't have to have all these tubing. If you're a young mother that has a baby and the baby keeps pulling out the tubing, you might want to have something a little easier that someone wouldn't pull out by accident.
Interesting. Cynthia, there's a scene in the book where Ellie's pump is running low, and so she has a backup plan. And those are injections that she's carrying with her to the restaurant. Will you tell our readers what those are and kind of why is she using that at that point?
So when this in the scene, so Ellie is using an insulin pen to inject the insulin manually into her body, which is what we had when my son was first diagnosed because we didn't have the pump yet at the time. We were always told that whenever if the pump fails or if the insulin is low in the cartridge, that is our backup plan to inject the insulin manually into his body with an insulin pen, and then there's a small syringe that is attached to the pen. What's interesting is I actually just had a conversation with a friend who's also a type 1 diabetic, and she's an adult. She's like a 40-year-old woman, and she was reading my book and she got to that scene. And then she said, that is so true because she's had that instances where she's had to inject herself with an insulin pen in public. And there are people who are not impressed, I guess, with somebody injecting themselves in public. But yeah, so going back to your question, it's a backup plan that we were told to have whenever the pump fails or if there's not enough insulin. It's just to have an insulin pen with a syringe, and then that's how you inject insulin into your body manually.
Well, Cynthia, you perfectly set up my next question for Mary, because I think this is the most heartbreaking scene of the book, which is how this person that she's out to dinner with treats her when first he finds out she has diabetes and then is disgusted when she has to do her injection with the pen. Mary, will you talk about that response and how somebody who's living with diabetes and needing to use insulin might respond if somebody's treating them like that?
Yes, it was disappointing reading about how the other person treated her, especially when that happened. And sometimes I think you have to do something like that at the table. You could certainly get up, go to the bathroom, come back, but the reality is it's a normal thing to go through. And I've had patients tell me stories about what have happened. And one patient in particular shared this very interesting story. He was dating and he was trying to figure out who would be the right match for him. So he would take him out to lunch and produce his insulin pen and put it on the table. If the partner, the person that was with him, made it through lunch, that was a person that got the second date. And I found it kind of amusing. And he says, "This is not funny. This is important. I have to find out who is going to accept me." And I said, "Well, wouldn't you want to wait a little bit longer just to see if you connect on different angles?" And he goes, "This is my life. You take it or you leave it." And I found that was so amazing that he said that. There have also been other stories that have come along when a provider says to a young man who's getting married, "You know, you may have difficulty having children, or your life may not be long in this world because of the type 1 diabetes." And this young man actually came in to talk about it. And I said, "I'm not sure who told you that, but that is not true. You have the chance to live a long life, the same as anybody else. You might have to work harder with the current disease that you have, but all of us will get something in this life that we actually have to deal with." And he was at the point prior to seeing me, he was going to meet with the girlfriend to cancel the wedding based on what the provider would told him. And this was only 20 years ago. So I think moving forward, when you hear that you have pre-diabetes, type 1, type 2 diabetes, it is not the end of the world. It's not pleasant to have something like this, but there are many, many things and great providers who can help you and your family deal with this disease.
And there should be no shame in managing your condition. I love that, the wisdom in that, Mary, so much. Cynthia, maybe you can close us out with some wisdom for listeners who care about somebody with type 1 diabetes. Anything that you want them to take away from this story, this episode, as advice or just some reflection from your own experience and from writing and having readers read your book?
As a carer, I guess just make sure that you look after yourself as well. Because as a parent having a type 1 diabetic son, it's hard for us, but it's harder for them because they have to go through it in their life. But it's 24/7 for all of us in the family, and that can lead to burnout really fast, I think. So I think just make sure that you look after yourself. Definitely look after your loved one with type 1, but also make sure that be kind to yourself as well.
I love that. Thank you so much. This has truly been my pleasure to talk about Salty, Spiced, and a Little Bit Nice by Cynthia Timoti. Listeners should go out and read this book right away because it's about so much more than diabetes. Thank you both for being here with me.
Thank you so much for having me.
Thank you.
Read Talk Grow is a product of the Women's Health Center at Mayo Clinic. This episode was made possible by the generous support of Ken Stevens. Our producer is Lisa Speckhard-Pask, and our recording engineer is Rick Andreessen. Visit our show notes to see the books discussed today and for links to other health education materials. Follow us on social media like Instagram and Facebook, or reach out directly to our email, readtalkgrow@mayo.edu, with suggestions for books or topic ideas. We'd love to hear from you. This podcast is for informational purposes only and is not designed to replace a physician's medical assessment and judgment. Information presented should not be relied on as medical advice. Please contact a healthcare professional for medical assistance if needed for questions pertaining to your own health. Keep reading, everyone.